Prime Minister Narendra Modi calls Chief Ministers of Gujarat, Goa and LG of Daman and Diu to discuss preparations and response to cyclone. Railways is taking all measures to face cyclone Taukte. Cyclone Taukte intensifies into an extremely severe cyclonic storm. Cyclonic storm likely to hit Gujarat coast this evening and cross the Gujarat coast between Porbandar and Mahua in Bhavnagar district during the night. In view of cyclonic storm Taukte, rescue and relief teams of the NDRF, Army, Navy, Coast Guard along with ships, aircraft and various states agencies have been deployed to minimize the damage. BMC cancels vaccination drive at all places today. Defence Minister Rajnath Singh and Union Health Minister jointly released the first batch of anti-COVID drug 2DG via video conferencing. The drug has been developed by DRDO's Institute of Nuclear Medicine and Allied Sciences in collaboration with Dr. Reddy's laboratories. Union Health Minister Dr. Harshvardhan presides over the 26th Group of Ministers meeting on COVID-19 situation, says vaccination drive is largely effective. The fact that difference in new cases in the past 24 hours and those who've recovered in the last 24 hours is almost 1 lakh. Recoveries outnumber daily new COVID cases yet again. Daily new cases are less than 3 lakh after 26 days in the country. Weekly positivity rate dips to 18.17% with more than 15.73 lakh tests done in the last 24 hours. CBI launches parallel raids and arrests Trinamool Congress ministers Firhad Hakim, Subrata Mukherjee, MLA Madan Mitra and former Mayor Sovan Chatterjee in its probe in the Narda sting case. Agency will submit the charge sheet and produce them before a local court. And in sports, in tennis, Rafael Nadal clinches his 10th Italian Open title. Nadal defeats world number 1 Djokovic in 3-set battle in Rome. Hello and welcome. You're watching DD News and DD India with me, Munmin Bhattacharya. Our top story: Prime Minister Narendra Modi interacted with doctors from across the country and got inputs with regard to their learning experiences and suggestions. And for more on this, we are joined by Sudhakar. Sudhakar, take us through the details of what transpired in the meeting. What were the suggestions that the doctors had shared with the Prime Minister, and what was Prime Minister's message to them? Sudhakar, are you with us? Our correspondent Sudhakar is with us. Sudhakar, if you can hear me, I was asking you that what was Prime Minister's message to the medical fraternity and what were the suggestions that the doctors shared this time around?
देखिए, बहुत महत्वपूर्ण बैठक और मनमोहन हमको पता है कि लगातार प्रधानमंत्री अलग-अलग क्षेत्र के लोगों से संवाद कर रहे हैं और खास तौर से किस तरह से पूरी परिस्थिति का न सिर्फ सामना किया जा सकता है बल्कि इस महामारी से देश को निकाला जा सकता है। और निश्चित तौर पर उसमें जो हमारे हेल्थ केयर वर्कर्स हैं, खासतौर से जो डॉक्टर्स हैं, उनकी एक बड़ी जिम्मेदारी, एक बड़ी भूमिका है। और निश्चित तौर पर एक पूरी स्थिति की उनके साथ न सिर्फ पीएम मोदी ने समीक्षा की है बल्कि लगातार उनका ये आग्रह डॉक्टर्स को रहा है कि खासतौर से सोसाइटी के वो लोग जिन तक उस तरह से स्वास्थ्य सुविधाएं नहीं मौजूद है या फिर वो उन इलाकों में, दूर दराज के इलाकों में, ग्रामीण इलाकों में रहते हैं जहां उस तरह का स्वास्थ्य तंत्र नहीं है, उन लोगों तक पहुंचने की कोशिश की जाए, उन लोगों को स्वास्थ्य सुविधाएं उपलब्ध कराने की कोशिश की जाए। तो एक इस चुनौती से किस तरह से सब लोग मिलकर सामना कर सकते हैं, आगे बढ़ सकते हैं। दूसरा, निश्चित तौर पर उनका आग्रह इस बैठक में रहा होगा, खासतौर से हम जानते हैं कि लगातार वैक्सीनेशन अभियान को आगे बढ़ाया जा रहा है, तेज किया जा रहा है। 18 करोड़ से भी ज्यादा वैक्सीनेशन देने वाला, सबसे तेजी से देने वाला।
Right, our correspondent Sudhakar reporting on the interaction that Prime Minister Narendra Modi had with the medical fraternity, where the doctors also gave suggestions to the Prime Minister on combating COVID-19. One issue that the Prime Minister raised was of ensuring that COVID-19 continues to be combated across the country, including in rural areas. Yes, Sudhakar, you were telling us about the points that were highlighted by Prime Minister during this interaction.
देखिए, महत्वपूर्ण है मुनमुन। एक बात ये भी है कि प्रधानमंत्री का ये भी आग्रह है कि खासतौर से जो टियर 2 टियर सिटीज हैं, जो ग्रामीण क्षेत्र है, वहाँ घर घर जाकर जांच हो, निगरानी पर ध्यान केंद्रित हो। तो साथ ही साथ जो ग्रामीण क्षेत्रों में स्वास्थ्य सुविधाएं हैं, उसके लिए जो संसाधन बढ़ाने की बात हो, उसमें एक बड़ी जिम्मेदारी जरूर डॉक्टर्स की भी है। सही जानकारी न सिर्फ लोगों तक पहुंचाने की एक चुनौती है, बल्कि साथ ही साथ जो दबाव बढ़ रहा है, अगर ग्रामीण इलाकों में, शहरों में जरूर हमने देखा कि एक ट्रेंड जरूर आया है कि बीते कुछ दिनों में लगातार केसेस बढ़े हैं, लेकिन अगर ग्रामीण इलाकों में कुछ राज्यों में चुनौती है, उस चुनौती से कैसे स्वास्थ्य कर्मी भी मिलकर एक भूमिका निभा सकते हैं। हम जानते हैं कि लगातार चाहे टीकों की आपूर्ति की बात हो, दवाओं की आपूर्ति की बात हो, जो अन्य इंजेक्शन है और तमाम चीजों कि किस तरह से लगातार राज्यों को सप्लाई बढ़ाई गई है, उत्पादन बढ़ाया गया है, लेकिन मिलजुल कर एक इस प्रयास को और पुख्ता करने के लिए और लोगों को इस आपदा से, इस महामारी से बाहर निकालने के लिए जो तमाम कोशिशें हो सकती है, निश्चित तौर पर जब डॉक्टर्स की, स्वास्थ्य कर्मियों की बात आती है, तो पीएम मोदी बार बार ये बात कहते हैं। बीते साल का भी उदाहरण वो लगातार देते हैं, किस स्थिति से जब हमारे पास संसाधन नहीं थे, अनुभव नहीं थे, और उस वक्त डॉक्टर्स ने उस चुनौती का सामना किया था, देश को बाहर निकाला था। तो उन्होंने ये भरोसा जताया है कि इस स्थिति से भी जो डॉक्टर्स हैं, जो हमारे स्वास्थ्य कर्मी हैं, स्वास्थ्य तंत्र में तमाम शामिल लोग हैं, बाहर निकाल सकते हैं। तो निश्चित तौर पर उस लिहाज से कह सकते हैं डॉक्टर्स का हौसला बढ़ाने के लिए, तमाम स्वास्थ्य कर्मियों का हौसला बढ़ाने के लिए जो अपना 100% न सिर्फ योगदान दे रहे हैं, लेकिन ये जो दबाव लोगों का, मरीजों का बढ़ा है, उस दबाव को देख रहे हैं, परिजनों को जो ढाढ़स बना रहे हैं, इस चुनौती से देश को निकालने की कोशिश कर रहे हैं, वो देश की तरफ से सराहना के अधिकारी हैं। देश उनका जरूर कृतज्ञ है, लेकिन निश्चित तौर पर अभी भी उनके ऊपर एक बड़ी जिम्मेदारी है। पीएम मोदी ने जरूर एक भरोसा दिया होगा कि वो तमाम डॉक्टर्स के साथ, स्वास्थ्य कर्मियों के साथ हमेशा खड़े रहे हैं, हमेशा खड़े रहेंगे, और जिस तरह की भी उनको जरूरत होगी सरकार से, केंद्र से, उसके लिए वो लगातार कोशिश करते रहेंगे। उस लिहाज से कह सकते हैं बहुत महत्वपूर्ण बैठक, और इस अहम मुकाम पर, क्योंकि देखिए कुछ जगहों पर, कुछ बड़े महानगरों से केसेस कमी हुए, लेकिन अभी भी किसी भी तरह की लापरवाही या फिर किसी भी तरह के ढील की कोई गुंजाइश नहीं है। तो ये आग्रह पीएम मोदी का जरूर रह सकता है इस बैठक में कि डॉक्टर से कि वो लगातार लोगों को अपील करते रहे कि कोविड से जुड़ी हुई जो तमाम सावधानियां हैं, जो तमाम प्रोटोकॉल्स है, उसका लगातार पालन किया जाता रहे, और जो डॉक्टर्स ने जो सलाह दी है कोविड मरीजों को, ठीक हो चुके मरीजों को, उन सलाहों को लगातार पालन किया जाए। क्योंकि डॉक्टर जब मरीजों से, मरीजों के परिजनों से बात करते हैं, वो जो बात हौसला बढ़ाने वाले कहते हैं, तो उसका बहुत ज्यादा और बहुत दूर तक असर होता है। उस लिहाज से भी भ्रांतियों को खत्म करने के लिए लोग ज्यादा सावधानी बरते, उसके लिए टीकाकरण लोग कराने के लिए आगे हैं, उसके लिए उन तमाम चीजों को लेकर बहुत महत्वपूर्ण कह सकते हैं ये बैठक में।
Absolutely, an interaction that Prime Minister Narendra Modi had with the medical fraternity in India on tackling COVID-19, as well as also on known COVID-19 diseases. We understand the Prime Minister saying that ensure that the focus continues to be on the vaccination drive, and rural and semi-urban areas are not neglected in the fight against COVID-19. Thank you, Sudhakar, for those updates. Let's move on now. Cyclone Taute intensified into an extremely severe cyclonic storm on Monday, and the cyclonic storm is likely to cross Gujarat coast between Porbandar and Mahua in Bhavnagar district later tonight. Extremely severe cyclonic storm Taute lay centered at 16:30 hours IST today over east central and adjoining northeast Arabian Sea. It is 190 kilometers west-northwest of Mumbai and 90 kilometers southeast of Diu. The current intensity is 170 to 180 kilometers per hour, gusting to 200 kilometers per hour. The Met Department issued a red alert for the coasts of Gujarat and Diu in the day. Post landfall outlook for Gujarat and Rajasthan were also issued. Rescue and relief teams of the NDRF, Army, Navy, Coast Guard along with ships, aircraft and various state agencies have been deployed to minimize the damage. Meanwhile, Prime Minister Narendra Modi called Chief Ministers of Gujarat, Goa and Lieutenant Governor of Daman and Diu to discuss preparation and response to Cyclone Taukte. Maharashtra too is bracing for the storm's impact with heavy to very heavy rainfall at isolated places in North Konkan, Mumbai, Thane and Palghar, and extremely heavy rainfall in Raigad. Flash flood threat has been issued over suburban Mumbai, Thane, Raigad, Palghar and Ratnagiri districts. Moderate to high threat has been observed over some watersheds and neighborhoods of Ratnagiri district of Konkan and Goa subdivision. With the approach of the impending cyclone Taukte, Chhatrapati Shivaji Maharaj International Airport had closed all flight operations from 11 to 2 in the afternoon as a precaution. The airport has so far witnessed 3 diversions. Chief Minister Uddhav Thackeray is closely monitoring the situation in the state. He took review of the situation in the coastal districts from the Chief Secretary as well as the Relief and Rehabilitation Secretary. So far, 12,420 citizens were relocated to safer places from Ratnagiri, Sindhudurg and Raigad districts. They've been evacuated to safer places. 3,896 people from Ratnagiri district, 144 people from Sindhudurg district and 8,380 from Raigad district have been evacuated to safer places. Mumbai, Thane and Palghar districts are on orange alert while Raigad district is on red alert. The concerned district and state administration has made all preparations for the rescue and relief work of citizens. In light with the warning against the cyclone, Brihan Mumbai Municipal Corporation has cancelled the vaccination drive at all places today. The 3-day vaccination walk-in drive of BMC will now commence on Tuesday and will last till Thursday. Continuing with the preparation for Cyclone Taukte, the Indian Air Force on Sunday deployed 2 C-130J and 1 AN-32 aircraft for transportation of 167 personnel and 16.5 tons of load of NDRF from Kolkata to Ahmedabad. A C-130J and 2 AN-32 aircraft carried 121 NDRF personnel and 11.6 tons of load from Vijayawada to Ahmedabad for the same purpose. Also, 2 C-130J aircraft transported 110 personnel and 15 tons of cargo for NDRF from Pune to Ahmedabad. The Railways is taking all measures to face Cyclone Taukte. The zonal and divisional control rooms are monitoring the situation and are in constantly touch with all railway stations in Southern Railway, Southern Western Railway, Konkan Railway, Central Railway and Western Railway. Divisions and zones are also in constant touch with state governments to monitor and plan for any contingency. Meanwhile, all emergency response of railways like accident relief trains, medical relief vans and tar wagons are put on high alert. The special intensive patrolling of vulnerable sections as done in monsoon season is also being carried out. Along with this, wind speeds are being monitored constantly in vulnerable sections and speed restrictions of train movement being imposed as per instructions. Temporary cancellation or pre-termination of a certain long distance and short distance passenger trains, keeping in view the evolving weather conditions. Further, a disaster management cell has been opened from 14th May. Railway lines serving Goa Port, VCJ and other stations are also being provided with proper announcements. All vulnerable areas and important bridges are being constantly monitored. Railways is also in regular touch with the state Met departments. Safety Department has also reiterated disaster management guidelines to prevent loss of life and damage to property. The first batch of anti-COVID drug 2DG developed by the DRDO was released today by Defence Minister Rajnath Singh along with Union Health Minister Dr. Harshvardhan. Defence Minister handed over the anti-COVID drug 2DG to Union Health Minister And Health Minister handed over the anti-COVID drug to DG to Delhi's AIIMS Director Dr. Randeep Guleria. An anti-COVID-19 therapeutic application of the drug 2-deoxy-D-glucose or 2-DG has been developed by DRDO's Institute of Nuclear Medicine and Allied Sciences in collaboration with Dr. Reddy's laboratories in Hyderabad. The clinical trials of the drug showed that it helps in faster recovery of hospitalized patients and reduces supplemental oxygen dependence. Speaking on the occasion, Defence Minister said that this drug brings new hope.
यह ड्रग जिसका यह इजाद हुआ है, यह आशा और उम्मीद की एक नई किरण लेकर आया है। यानी हमारे देश के सामने यदि बड़ा से बड़ा चैलेंज आए तो हमारे वैज्ञानिकों के अंदर वह क्षमता है, वह ताकत है कि उसका मुकाबला वह कर सकते हैं। और जो यह ड्रग का इजाद किया गया है, मैं समझता हूं कि हमारे देश के वैज्ञानिकों की एक जो साइंटिफिक कैपेबिलिटी है उसकी भी एक मिसाल है, उसका भी एक उदाहरण है।
Rajnath Singh further said Army has contributed significantly as they open their hospitals for civilians.
मिलिट्री हॉस्पिटल्स में भी आपको जानकर खुशी हुई होगी, समाचार पत्रों में आपने पढ़ा होगा कि यह भी व्यवस्था कर दी गई है कि सिविलियंस का भी वहां पर इलाज हो सकता है। और मेरी जानकारी है कि कई मिलिट्री हॉस्पिटल जहां पर पहले सिविलियंस का इलाज नहीं होता था, और मिलिट्री हॉस्पिटल में बहुत ही अच्छी तरह उन सिविलियंस का भी इलाज हो रहा है। लेकिन यह सब कुछ जो हमारी आर्म फोर्सेस के द्वारा किया जा रहा है इस चैलेंज को मीट आउट करने के, लेकिन साथ ही साथ सीमा पर से हमारा ध्यान हटा नहीं है। सीमा पर जो हमारी तैयारियां हैं वो तैयारियां यथावत हमारी हैं, हम बराबर हमारी नजर उसके ऊपर भी रहती है और इस काम को भी हम साथ ही साथ कर रहे हैं।
Speaking on the occasion, Union Health Minister Dr. Harshvardhan said that the new anti-COVID drug 2-DG is one of its kind indigenously developed research-based drug which will reduce recovery time and oxygen dependency.
भारत के वैज्ञानिकों के द्वारा DRDO के सहयोग से हमारे आदरणीय राजनाथ सिंह जी के नेतृत्व में ये शायद हमारी पहली इंडिजिनस रिसर्च के आउटकम के तहत दवा है जो सीधे सीधे कोविड के वायरस के प्रकोप को पूरे वैज्ञानिक दृष्टिकोण से कम करने का पूरा पोटेंशियल रखती है।
The Union Minister also congratulated DRDO and its scientists while adding that under PM Narendra Modi's leadership, DRDO has played an important role in the fight against the pandemic.
इस अवसर पर मैं DRDO को और उसके सभी वैज्ञानिकों को इस बात के लिए धन्यवाद करना चाहता हूँ, बधाई देना चाहता हूँ, क्योंकि जब कोविड के खिलाफ लड़ाई शुरू हुई पिछले वर्ष तो हमने देखा कि प्रधानमंत्री जी के नेतृत्व में पूरी सरकार जो है होल ऑफ गवर्नमेंट और होल ऑफ सोसाइटी अप्रोच के साथ उसने लड़ना शुरू किया और उस समय से लेकर आज तक DRDO ने उसमें अग्रणी भूमिका निभाई दूसरे डिपार्टमेंट्स के अंदर।
Let's now take a look at the latest on COVID-19 cases in the country. In an encouraging development, daily new COVID cases being registered in India are now less than 3 lakhs per day after 26 days. 2,81,386 new cases were registered in the last 24 hours. A declining trend and the weekly positivity rate is also observed. It stands at 18.17% today. State-wise, number of districts with higher positivity rate in Karnataka showing most number of districts, that is 27, with more than 20% positivity rate, and Madhya Pradesh consisting of the highest number of districts, 38, with more than 10% positivity rate. India's cumulative recoveries have reached 2 crore 11 lakh 74,076 today. The national recovery rate stands at 84.81%. 3,78,741 recoveries were registered in the last 24 hours. Also, 24-hour recoveries have outnumbered the daily new COVID cases for the 6th time in the last 7 days and consistently in the last 4 days. 10 states account for 71.35% of the new recoveries. India's total active caseload has decreased to 35,16,997. It now comprises 14.09% of the country's total positive cases. A net decline of 1,01,461 cases has been recorded in the active caseload in the last 24 hours. 10 states cumulatively account for 75.04% of India's total active cases. Union Health Minister Dr. Harshvardhan presided over the 26th Group of Ministers meeting on COVID-19 situation today. He said that vaccination drive is largely effective. He stressed on the difference in the new cases in the past 24 hours and those that have recovered in the last 24 hours is down to almost 1 lakh. He added that in the past few days, the number of active cases are less than what they were last week.
On 8th May, we had just over 4 lakh new cases in the last 24 hours, and at that time, almost in a row for 4 continuous days we had over 4 lakh cases. Today, on 17th May, in the last 24 hours we have seen 2,81,386 cases in the country.
The minister also highlighted that after 26 days, the cases are now less than 3 lakh on a daily basis.
The number of recovered cases in the last 24 hours were 3,18,609, and today this number has risen to 3,78,741. Right now, just to keep you updated, today we have 35,16,997 active cases in the country, and for the first time after almost 26 days, we have seen cases less than 3 lakhs.
The cumulative number of COVID-19 vaccine doses administered in the country stands at 18,29,26,460 as on the 121st day of the vaccination drive. A total of 6,91,211 vaccine doses were given yesterday. CBI has arrested 4 then ministers of the Trinamool Congress government in West Bengal in a case related to the Narda sting operation. CBI registered the instant case on the 16th of April 2017 on the orders of the Calcutta High Court. It was alleged that the then public servants were caught on camera while receiving illegal gratification from the sting operator. After investigation, prosecution sanction was sought against the concerned public servants, and the same has been received from the competent authority on 7th May this year. Sanction for 1 more accused, the then SP, was received and he was earlier arrested. Presently, he is on bail. Charge sheets against the 5 accused persons whom prosecution sanction have been received is being submitted. Investigation is continuing. Trinamool Congress Chief and Minister Mamata Banerjee also reached CBI office this morning. In sports news, Porto will host 29th May Champions League final between Manchester City and the Premier League rivals Chelsea. British tourists will be able to visit Portugal from today after Lisbon lifted restrictions introduced in January to check the spread of COVID-19. Lisbon's move came after London had placed Portugal on its green list of countries to visit without having to self-isolate on returning home. Thousands of English football fans can be expected to descend on the venue, although governing body UEFA has confirmed that up to 6,000 tickets will be made available to each club. More than 80% of Japanese oppose hosting the virus-postponed Olympics this year. A new poll published on Monday showed with just over, in fact, less than 10 weeks until the Tokyo Olympics. The latest survey comes after Japan expanded a coronavirus state of emergency on Friday as the nation battles a fourth wave of virus infections. The surge has put pressure on the country's healthcare system, with medical professionals repeatedly warning about shortages and burnout. And with that, we come to the close of this news bulletin. News and updates will continue on DD News and DD India.
आइए मनाते हैं